Understanding tongue tie, more than just a tight tongue. Tongue tie occurs when the thin strip of tissue connecting the tongue to the mouth floor, called the lingual frenulum, is too short or tight. This restriction can vary in severity, with some cases being barely noticeable, while others significantly impact daily life. A tight frenulum can hinder the tongue's ability to move freely, affecting essential functions like breastfeeding, speech, and even oral hygiene. Recognizing the signs of tongue tie is crucial, as early diagnosis and intervention can prevent potential complications. From feeding difficulties in infants to speech impediments in older children and adults, the impact of an untreated tongue tie can be significant. Understanding this condition empowers us to seek appropriate care and support, ensuring that a seemingly small string doesn't tie down our potential for a healthy and fulfilling life. When breastfeeding becomes a struggle. Tongue tie's impact on infants. For newborns, the ability to latch onto their mother's breast and suckle effectively is essential for survival and growth. Tongue tie can make this natural process challenging, leading to frustration for both mother and baby. Infants with tongue tie may struggle to latch deeply onto the breast, often resulting in painful nursing for the mother and inadequate milk transfer for the baby. This difficulty in breastfeeding can manifest in various ways, including poor weight gain, constant fussiness, and frequent feedings that seem unsatisfying for the infant. Identifying and addressing tongue tie in infants is crucial for ensuring successful breastfeeding and a positive feeding experience. Early intervention can alleviate feeding difficulties, promote healthy weight gain, and foster a strong bond between mother and child. Beyond baby talk, speech and oral challenges from childhood to adulthood. Speech development, a complex process that relies heavily on precise tongue movements, can be significantly impacted by tongue tie. Children with restricted tongue mobility may struggle to produce certain sounds, particularly those requiring the tongue to reach the roof of the mouth, such as L, R, T, D, N, and TE. These speech difficulties can lead to communication challenges, potentially affecting social interactions, academic performance, and self-esteem. Untreated tongue tie can also affect oral hygiene practices, making it difficult to remove food particles from the teeth and gums, increasing the risk of cavities and gum disease. Furthermore, individuals with tongue tie may experience difficulty swallowing, playing wind instruments, or even licking an ice cream cone, highlighting the wide-ranging impact of this condition throughout life. Section 4. Tongue tie's unexpected troublemakers, from eating to cleaning. Beyond the obvious impact on speech and breastfeeding, tongue tie can present a surprising range of challenges in daily activities. Eating, a seemingly simple pleasure, can become a source of frustration for individuals with restricted tongue mobility. Biting, chewing, and swallowing all require coordinated tongue movements, which can be compromised by a tight frenulum. Oral hygiene, another essential aspect of overall health, can also be affected by tongue tie, leading to plaque buildup, cavities, and gum disease. This emphasizes the importance of recognizing and addressing tongue tie, as it can have far-reaching consequences beyond the initial concerns of breastfeeding or speech difficulties. Section 5. Untangling the knot treatment options for a freer tongue. The good news is that tongue tie is treatable, with procedures varying depending on the severity of the condition and the age of the individual. For infants, a simple and relatively painless procedure called a frenotomy is often performed. This involves using sterile scissors to snip the tight frenulum, allowing for immediate improvement in tongue mobility. In older children and adults, a similar procedure called a frenectomy might be recommended, often with the use of a laser for minimal bleeding and faster healing. Following either procedure, exercises and stretches are typically prescribed to help strengthen the tongue muscles and prevent reattachment. With proper diagnosis and timely intervention, the limitations imposed by tongue tie can be overcome, paving the way for a healthier and more fulfilling life. Section 6. Early detection, lasting impact. Why addressing tongue tie matters. Early detection and intervention are crucial when it comes to addressing tongue tie. By recognizing the signs and seeking appropriate care promptly, we can minimize the potential negative impacts of this condition on various aspects of life, from breastfeeding and speech development to oral health and overall well-being. For infants, addressing tongue tie early can be the key to successful breastfeeding, ensuring proper nutrition and a positive bonding experience for both mother and baby. By recognizing the importance of early detection and treatment, we empower individuals to live healthier, happier, and more fulfilling lives free from the limitations of a restricted tongue.